one of the things that we've really noticed is that, and this is true across the country, is that emergency department volumes are actually way down. Obviously, there's good reasons for this. People are concerned about coming in and being in contact with any people that could be sick with the COVID virus. But also, they're not going to work, so they're having fewer work injuries. They're not driving as much, so there are fewer car accidents. They're not necessarily doing a lot of the things they normally would do that would put them in harm's way, and they're not getting other diseases. They're not getting common colds that they would, because the social distancing is working the same way for those as it does for COVID. So a lot of these things that normally cause disease or injury are not occurring, and so our volumes are down for that reason. But one of the things that we're most concerned about is that people aren't coming to the emergency department when they should be coming to the emergency department in times like this because they're afraid that they're going to get COVID.
Yeah, emergency physicians all across the country are starting to wonder where did all of our normal patients go? We have anecdotes even here locally, things like appendicitis. Talking with a surgeon the other night who said that she didn't think that she'd done an appendectomy when she was on call for 6 weeks, whereas normally she usually has an appendectomy every single night she's on call, maybe more than one.
Yeah.
And so we really start to kind of worry about where those things are at. And our biggest concern is that people may be delaying care or concerned about coming in because of coronavirus and ending up making themselves sicker by delaying care for something that if coronavirus had never happened and there was no concern whatsoever about any of this stuff, they would have never batted an eye about coming in to get checked out for.
Yeah, heart attacks, strokes, the guy who is at home and he's maybe got a little funny vision in the left eye or a little bit of a facial droop, and he's like, I don't know if I want to go in for this. But remember, like stroke, heart attack, sepsis, like a really bad infection, time is of the essence. Like literally hours, even minutes count, and so that's why I can't. But people are waiting days. Maybe I can get into my family doc or my cardiologist or whatever, and they're hoping they can kind of put it off. And man, that's we talk about like time as muscle. When your heart being a muscle, and the longer it goes without blood, the worse it gets, and the more you're incapacitated for the rest of your life potentially if you don't get that seen. And so, and that's why we're here to really emphasize the critical nature of getting in here and getting seen if you think that you have an emergency. And an emergency is kind of whatever you consider it to be an emergency.
Yeah, a lot of the prep when you think back now, you look back 4-6 weeks ago, and we knew this was coming. We had the opportunity to prepare. We're very fortunate in Iowa, being in the Midwest. Not a tremendous population density, not a lot of international travel. We definitely have been behind the curve here. So we had the distinct opportunity to learn from best practices, the things that were going on the coasts and in other hot spots around the country. But regardless, when we look back now, a lot of the planning and preparation we were doing back in early March, late February, even early March, was all the preparation to mitigate the risk for exposure and illness for ourselves as healthcare providers, but also to mitigate and minimize risk to non-coronavirus patients in the hospital. So a vast majority of the prep that we were doing was to keep ourselves and to keep you safe. And we feel very confident in the processes that we have in place regarding that right now, both for our own safety and your safety in coming to the hospital as well. There's been a lot of push on social media, stay home for us, healthcare workers, stay home for us, with concerns about the healthcare workers getting ill and a lack of PPE. And I'm very happy to say that at St. Luke's, anyway, we in the emergency department, we're very comfortable with our amount of PPE.
Yeah.
And the learning and education that we all did for ourselves to protect ourselves from getting ill.
Yeah, we've definitely taken best practice from the other states, like New York. They've put out a ton of information, and we gobble that up because we have the same concerns that the public does, and so we keep ourselves very much educated on the forefront of like best practice and what's the right thing to do. And so from the very early on, we were wearing full mask and goggles, and we felt it necessary to go in and say, hey, pull my mask down. Hey, I'm Ryan Sundermann, and I'm sorry that I have to wear this mask, but it's for your safety. And very quickly, patients were like, oh, we're really glad you're wearing that, because then they had that confidence that we were trying to keep them safe as well, because we couldn't afford to have half of our doctors become ill or contract the virus and not have them available, because we didn't know what to expect. But our volumes have been low. But because of that, we've also been able to refine what we do. So we're very diligent, we're very careful about wearing all of our protective equipment, making sure that we sanitize our hands before we go in, when we leave the department. I mean, everything. We all carry, I got hand sanitizer in my pocket right now, because you're all doing it at the store, you're doing it when you go out to the park or any place that you go, you have your family do it. We're doing that to even the next level. When we go into somebody who with a suspected COVID infection, we're gowned in disposable gowns and things like that. So
yeah, I don't want to forget to thank the public and the community for the outpouring of support for us with homemade masks and caps,
or leftover N95 masks from their last. They remodeled their kitchen and they've had a stack of them at home and they donated them. That's been huge.
Goggles, individuals, businesses. Yeah. We feel very fortunate to be part of the community and the support. Absolutely. The support that we've gotten, and we appreciate people being concerned about our safety, but we feel very comfortable with our safety at this point, and I think the message here is we definitely don't want you to sacrifice your own health out of fear for the safety of the healthcare workers.
We've got it now. We've got this process down. Not only can we take care of those patients and keep them isolated who potentially do have the disease, or if we know they have the disease, we definitely much keep them isolated. We have what are called negative pressure rooms, so that nothing that they're breathing in or out can escape the room they're in. When they leave that room literally gets decontaminated to the like a degree that we've never seen before. And then those patients that come in, we try to isolate them. We keep most of our respiratory patients in one area of the emergency department. The rest of the patients come into a different area of the department, and even the providers are kind of different in those areas. So the chance of you getting contaminated is exceedingly low. I mean, you can never make it zero, but for what I'd say is, I know that we're doing a good job because we have 0 providers who have been ill with this, with COVID virus. So the precautions that we're taking are keeping us safe, and so I know that we're keeping you safe in that regard.
Yeah, exactly. Again, if most people have masks they're wearing out in public right now, but if you arrive and you have a guest with you and you don't have masks, the hospital will provide you a mask, whether you're there for a respiratory reason or not. And geographically, you're going to be separated based on your presenting symptom and sign of disease to minimize risk for all involved. From the very moment you arrive at the emergency department until you leave, the physical process, the pathway, the steps that you take to exit the emergency department upon the completion of your visit are even different than they used to be.
Yeah, so when you come in, you get screened by an individual out front, and they determine whether you have relatively mild symptoms and you're somebody that can be our shed patient. You've seen a lot of the tents that are out in front. We were talking earlier about how some of the early March and April winds tried to blow our tent away, and so we had to convert to a shed, which is much more secure. And so now we have a shed, not a tent, so you might see that out front. But we're not storing lawnmowers in there. That's a patient care area. So we can do basically a full physical exam, short of like maybe pressing on your belly, which our nurse can actually do for us. We'll be out there. And so we can do a fairly full examination in order to keep you out of the department. However, if your symptoms are severe and we feel like you feel like you need to be seen in the emergency department, we will definitely bring you in. But also, if you have symptoms that have nothing to do with what you think could or could not be related to COVID, chest pain, which can be COVID also, but sprained ankles, workplace injuries, lacerations, falls, you name it, you will come into a separate emergency department or a separate waiting room, if you even have to go to a waiting room, which right now you don't. People, because the volume is relatively low, they're coming straight back for the most part. You're going to be seen in a very clean, very safe environment. You won't have any exposures, and you talked about the things, how we've even changed the path out and like what people are doing when they leave. So
yeah, I think the key, the really important thing here is remembering that we understand that access to care is really hard right now. The primary care clinics and urgent cares don't necessarily have all the same access that they had before. We know that people are really nervous about violating societal expectations and norms for social isolation and distancing. They may be concerned about themselves, their own health, potentially getting exposed to the virus by coming to the emergency department. They may be concerned about exposing the healthcare providers and following the Stay Home for Us movement. But we're here, And we definitely don't want people's health care to be compromised by this virus when we are here, all hands on deck, ready to go to take care of you just like we always have. And want to assure you that we feel comfortable in the processes that we have to keep you safe, to keep us safe, because we don't want anyone's health to suffer because of this.
If you think you're sick, if you think you're chest pain, shortness of breath, regardless of what you think it is, but assume if you feel like you're ill and you cannot get in to see your primary care provider, come see us. We're open 24/7. So if you have chest pain, shortness of breath, stroke symptoms, a bad injury, a fall, unusual pains. Because the other thing is, we've seen a lot about how this is a respiratory illness with COVID. Well, in the early stages of it, most often it's things like headache and body aches that you get with other viral illnesses that can be the presenting symptoms of COVID. So by all means, if you think that you're sick, come and see us. Because the other thing is, if you have a severe headache that's not typical for you, it could be COVID, but it could be something else. So just be very conscious of that. And if you feel like you need to come in, come in. I think one of the key things is that you realize if you have symptoms, doesn't matter what they're related to, if you think that you're ill, just like before this whole epidemic, you need to come to the emergency department and let us take care of it. At a minimum, talk to your primary care provider and help them help you. Call the nurse line, something like that, so that we can guide you to where you need to be. But we're always here for you.
Yep, stay safe. Continue social distancing, washing your hands, covering your cough.
Yep.
Iowa's doing a great job
Go Iowa.
flattening the curve and limiting and delaying the surge. Congrats.